Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. I'm Wael Berro, your host for today, and today is a pleasure to have Dr. Emad, who's going to talk to us about the relaunch of the Emirates Sports Medicine Clinic at the 𝗠n. Dr. Emad.
Good morning. Thank you so much for this. I hope in this episode we can highlight really the new exciting relaunch of the Sport Med and the Emirates Hospitals Group, the clinics on the 𝗠n.
Can you please tell us more about your background before we kind of start talking about the clinic and the sports medicine facilities we have?
My name is Dr Emad Al-Barrishi. I'm an orthopedic consultant. Actually, I have experience about 25 years in orthopedic. I started my residency program in Jordan. Then after that, I moved to Germany for fellowship. I did fellowship at that time for arthroplasty and joint construction in Hamburg Endoclinic. Then I shifted to Park Clinic for sports fellowships. Also, I went to the States to complete my sport medicine fellowship as a part of a second fellowship. As you know, sports medicine now, it has high demands between either the athletes or the young peoples. Then I went back to Jordan. I worked in Jordan for 5 years. After that, I moved to Saudi Arabia. And in Saudi Arabia, we established a department for orthopedic with my colleagues to have all the subspecialties over there. One of them was the sport medicine and arthroscopic surgeries. I have been part of the education program of Al-Faisal University as an assistant professor over there and worked with the Saudi Commission for the Saudi board. Finally, I moved to Dubai. And I started my career in Dubai 3 years ago here as an arthroplasty consultant and sport medicine. And I joined Emirates Hospitals Group as a part of a project to take the orthopedic services and medicine and or that branch of medicine actually to a next step in the future, because really now with all new technologies, AI, this is a new era, and we have to cope all of these things that happened around us in the world.
Perfect. That's a highlight of the last couple of years of your life. Thank you very much, and welcome to the group. It's good to have you over. And later, after the episode, you tell me about your secret for looking 40-year-old despite all this extensive experience.
Yeah, it was. It extended all of that years. You know, to be a surgeon, it's a journey, and you gain experience every day. You are gaining an experience, and you are seeing something new, and this must be reflected in your patients and the quality of the service that you are really giving to your patients, and also on your skills and knowledge. And it is a mission to be updated also at the end, that for the next generation, that really to qualify them for the next generations after them.
No doubt, and it's an ongoing journey. Let's focus at the Emirates Sports Medicine Clinic at the 𝗠n. It's all the new, it's being relaunched. We're all excited about it. Tell me about the facilities, tell me about the services you'll be offering there.
Well, as you know, Sport Med Clinic, it is an orthopedic excellence center, and it is one of the facilities to the Emirates Hospitals Group. It's owned by them and run by them. And that center actually, when it's established years ago, it was designed to be a center of excellence for sports medicine, for the professional athletes, even for normal people, for healthy people, for young people. And that center actually, at that time and now, it contains a lot of advanced devices for diagnosis and services, either pre-diagnostic or post-diagnostic or post-therapy devices. Now, in the past years, it was working in a proper way, but the hospital management or the group management, let's say, they took the decision to go a step to the future, that the services will be, let's say, not more sophisticated, but really more like matching the new technologies that we have it. And here where we met, actually, me and my team, because we are 10 consultants who are covering the whole subspecialties of orthopedic, sports medicine we have team, arthroplasty, spine, pediatric, hand, foot, and even diabetic foot center. Here we met with them and we agreed that really we need to go this step together. So thanks for them actually to invest in the future, okay, for the services of the patient. So we relaunch it as an orthopedic excellence center, but it's focused and it has the whole facilities and devices for the let's say sports people, either the professional sports people for all sports, not just one sports, and even to the, let's say, normal people, who is not a professional sports.
Yeah, I was going to ask this actually. I mean, I consider myself normal enough, but I love doing sports. I play sports. I still try to do it every week. I encourage my patients to do it as part of wellness. But we have, if we want to call them the weekend warriors, the people who try to push themselves on the weekend. We have the professional athletes who wake up every day. They're very rigid. But what you're saying that the clinic is not for this specific group, but it's actually for anyone who's into sports or should be into sports.
Thank you for this, because, you know, usually when you are mentioning any sport medicine center or any sports orthopedic injuries, people just think that it is just for professional sports. But no, now sports is part of our lifestyle, and we have to have sports all the time to tolerate the whole, let's say, stresses during the day from work and so on. So yes, this center, it will help even as if you will name it like normal people, yeah, or who is doing light sports, or really who wants to maintain their body in healthy shape. So the devices over there that we have it, we have like the gait lab analysis, full gait lab analysis with foot analysis. Now that one will serve you in both ways, either for your normal daily stresses, and for the professional, even healthy people, the children. You know, for the children, because sometimes, you know, the parents maybe will be worried about their children, that if they are walking in proper way, if there is delay or something. Also, we have these diagnostic tools for them, and they are not sports athletes. But we are proud to have all of these technology for the professional sports. As you know, now professional sports and athletes, let's say, they have special care. And thank you for this branch of medicine, because it push along really to develop all of these materials or all of these tests for diagnosis and treatment, and it was reflected, until now it is reflected on the outcome of the normal people.
Perfect. Thank you very much for this. So I'm going to be your patient today. So I'm going to say that, okay, I'm coming to see you. What would be my journey like? And I know in medicine we talk of acute injury. So I played yesterday football, let's say. I injured my knee. I decided to come to the clinic. Or I've injured my knee 6 months ago, and this recurrent every time it happens. So let's put it into two types of injuries. What would I expect as a patient? And most importantly, as a family doctor, it's always prevention. What would be the advice when it comes to how can I avoid becoming your patient in a way?
Okay. If you allow me, I will put it in this way. If you are a patient, once you will arrive to our center over there, of course, the normal checkup for your systems will be happening. Then you will be seen by the orthopedic consultants, one of the team over there. he will go and examine you, which is the ordinary examination and history and all of that. The good thing in that center, you don't need to go outside of that center to do any kind of investigation. I mean, in the same place, you can do X-ray, ultrasound, MRIs, which is a pre-diagnostic tools to help the doctor to diagnose you. Now, this is, we call it static mechanism of diagnosis. The additional thing that we have it, and I'm sure that we are unique in this, and it is not available. Maybe I can say even in the Middle East, some of the devices that we have it, we have the dynamic test. And the orthopedic or the musculoskeletal systems, either the knee, the shoulders, the back, all of that, it is a dynamic organs in the body. So you need something to test these muscles and bones and joints during the dynamic phase. So we have first, as I told you, full gait lab analysis, which is usually you will start to work on a magnetic platform, and there is an AI cameras, motion cameras around you. They will start to capture your motion, then they will send it to the software to do the full analysis and the strength of your muscle. Now, this will inform us that okay, you have injury in the knee, let's say, you have maybe some structures are damaged, but your mechanics in your knee after this injury, okay, affected in that way. So this will help in diagnosis, this will accurate diagnosis, and will help in the rehabilitation. Now, after that, maybe you are a regular doing workout on regular basis, or a professional. Also, we have the VO2 Max, which is usually the device that can measure the oxygen consumption during sports. Also, we have a lot of devices like the occupational device that will test each single muscle that how you have it and the balance. Now, after getting all of that diagnosis, we will start to put the treatment plan, either conservative, which is maybe include physiotherapy, and we have a physiotherapy department, full department with the whole advanced techniques over that, or maybe we need surgery, or we need some interventional medicine with minimal invasive techniques. So usually how is we are doing. Now, it is not just to see you and to decide the surgery or the treatment or whatever we plan to do it, the follow-up. We have team for follow-up. Now, the team follow-up, I mean that not just somebody to call you every now and then that to check on you that, are you doing well or not? This is nice and this is mandatory, but I mean, even after the treatment, the same machines, they have another software to retest you again. Okay, was our treatment beneficial? Was it good for you? Are you satisfied about our treatment? You don't have pain. Now, your knee, is it really 100%? You can go back to your sports or your activities that you need your knee? And we call it, this is fitness exam. And the same fitness exam, it will be by the consultant himself in the ordinary way, but also we will use all of these techniques, which is guided by the new facilities, devices that we have and machines governed by the AI to give you really you are fit or not. And by the way, this is very important for the professional athletes, because you know, when you are talking about these professional athletes, you cannot send them to the courts to play or to have to continue his league at that time, and he's still not 100% fit for that.
I'm definitely sold. I'm actually going. I was joking earlier, saying like I will be your patient, but I think I might be your patient after all, because it's very exciting.
you are most
and I like the passion there. Okay, so you mentioned minimally invasive surgery, and you and I were yesterday at a lecture when we were talking about the role of minimally invasive surgery in spinal field. So what about orthopedics? What about sports medicine? And where does that fit in your? I know you mentioned it earlier briefly. You said this. Like some patients might require minimally invasive. Can you
thank
go
you.
through that?
Really thank you for this question. And this is a topic we need to highlight it. Now, on orthopedic surgeries, let's say most of the surgeries now it's going to minimal invasive surgeries. Now, if we will go to the joints, apart than the spine, if we will go to the joints, now nearly the whole joints, we are doing our surgeries using the scope. That we simply do a simple incision, put less than 1 centimeter, put the camera inside as another simple incision. We put our tools inside and correct everything. Like in shoulder, we can correct everything using this technique, and we call it arthroscopic surgeries, which is using the camera and the scope with limited one. Now, in the knee as well, in the hip, we have also a consultant for just hip arthroscopy and the hip injuries that usually a big challenge actually for people and athletes. So that field of surgery, we I think we have a very, let's say, we have a high experience in this, let's say, okay. We are doing now nearly all of our surgeries using either, if you will call it minimal invasive or arthroscopic surgeries, knees, shoulders, elbows, and so on. Of course, still the joints replacement, total hip replacement, total knee replacement. Now, it is not a minimal invasive, but we can use a small ones also. Also, this is techniques and the robotics in these surgeries.
And it's definitely fascinating. And as a patient who actually had knee surgery, I can tell you the recovery, the process is amazing when it comes to minimally invasive and arthroscopic surgery. Now, I'm going to go to a concept of excellence center. We hear it from time to time. We hear it a lot sometimes. It's easy to know. But I want to talk about the Emirates Sports Center at the Palm and the fact that it's an orthopedic center of excellency. Can you explain more why and what makes it such an excellent center?
As I mentioned earlier, it is the things about the pre-diagnostic, the care that we have at the pre-diagnostic, the tools that we use it for the diagnosis, and let's say the coverage for the whole joints, the coverage for the whole subspecialties, the whole problems, either sport or not sport injuries related, even as I mentioned earlier, for children to check their gait. Now, the excellence really to be diagnosed 100% correct, and to be treated in proper way, and to be followed in proper way. Now, the follow-up usually in orthopedic surgeries, it is the big challenge actually. Now, because when one of the limbs is affected, it's hard to get you back to the track as you before. And this is need physical therapy, reassurance, evaluation from now and then, any relation to other joints or other systems that you have problem with it. So the excellence that to send the patient back to his normal life, pain-free with full function. This is depending on the facility itself, the technology in that facility, the consultants of that and their experiences over there. This is the way how I see the excellence. It is maybe you can put plenty of machines over there, whatever, MRIs, but really the patients need to be followed that they are really back to their normal life after you treat them, let's say, in this professional, advanced way.
Dr. Emad, it's a real pleasure to have you here at the podcast today, but more importantly at Emirates Group. Thank you very much for taking time to be with us today. Any take-home messages you want to tell our audience today about the Emirates Sports Medicine Center at the Palm?
Well, I prefer to phrase it in this way. Do sports as much as you can, okay? And let our center to care about these injuries to make you sure 100% that you will go back to your healthy life. Now, sports injuries, it is not a disabling injuries. It can be treated if it will be handled in a proper, advanced, sophisticated way. And I wish health for everybody and to have a happy life.
This brings us to the end of our episode today. Thank you for listening. Thank you for watching. Stay tuned for another episode of Al-Majlis podcast by Emirates Hospital Group shortly.